I wanted to convene this first ever Q-LEAPx, which is the Quality Reviews Leadership Excellence Across Patient Experience. This is a new concept for us. It's a virtual roundtable, basically. As I like to say to Jill and Michael, I don't really like conferences. They're all pretty much cookie cutter, and especially in the time of Zoom. And what I love about Zoom, however, is it can get people from different geographic regions together and just collaborate. And I think that the striking similarities between all of our clients is there's just this thirst for everybody to learn from each other, from us. And we really want to be a facilitator in that regard because you all are longtime users of our tool to varying degrees. And you've all really shaped the evolution of our service. And I say service in particular because it's beyond just the tool, it's how we and the folks listening in interact with you all. So first of all, I wanted to say thank you for being valued partners, because without you, we wouldn't have the service and we wouldn't have a good product. And more importantly, we wouldn't have new products to develop because you are the frontline clients and you tell us what you need. So having said that, I'd like to turn it over to all of you basically. And if you could just go ahead and introduce yourselves, and I'll just call out your name so that we can just go in order here. So you know me, I'm Ed, you know Jill, she's on mute, and then you know Michael. But let's start with Ruth Mana from Memorial Sloan Kettering. If you could just unmute and just tell everybody who you are.
Good morning, or actually it's just noon here. Good afternoon, everybody. My name is Ruth Mana. I am Associate Director in Patient Experience Partnerships here at Memorial Sloan Kettering Cancer Center in New York City. Happy to be part of this call. I'm just one of many PX stakeholders in my institution, but happy to participate in this discussion. Thanks.
Thanks, Ruth. And Rebecca?
Hi, my name is Rebecca Asmussen. I'm a project manager at Mount Sinai Health System. My part of the health system is the Health Network, which focuses primarily on the non-Manhattan ambulatory practices. So the projects that I manage include patient access, patient experience, patient satisfaction, and some strategic planning work. So it's nice to be here. Nice to meet you all.
Thanks, Rebecca. Okay, Michelle from Grady.
Hi there. Just turning on my video. I didn't want you guys to watch me eat my lunch. So I'm finished now. Thank you. My name is Michelle. I'm the Vice President of Patient Experience at Grady Health System in Atlanta. Been in healthcare, we'll just say over 20 years. I don't want to age myself too much, but I started right out of elementary school is what I tell people. So absolutely love what I do and absolutely love this product. So I'm happy to meet all of you. Thank you.
Thanks, Michelle. And Dr. Naomi Jamal.
Hi, good afternoon. My name is Naomi Jamal. I am the Chief Quality Officer, and I head the Department of Quality and Population Health at Swope Health Services, which is in Kansas City, Missouri, and is a federally qualified health center. We're sort of very focused around the quadruple aim. So, of course, one of those aims from a quality perspective is the patient experience. And so essentially that is how we typically tend to approach the patient experience at Swope and why it happens to be under quality and population health.
Thank you. And Kate Newbold.
Well, good afternoon, everyone. Afternoon where I'm at as well. I'm the Director of Digital Design and Customer Experience for Beacon Health System. We're a $2 billion health system located primarily in Northern Indiana. We serve some of Southern Michigan too. So 4 different hospitals, 60 plus medical group sites. One of our hospitals, Critical Access Hospital. We've been clients of Quality Reviews for almost 4 years now. And I was actually brought into Beacon. My first position was to implement and scale quality review solution across the system. So it's been a great partnership, and I am already learning a lot about how you all have your teams structured and patient experience structured at your organization. So appreciate the opportunity for the conversation.
And Naomi Meyer.
Hi, everyone. So I I'm a patient experience lead for New York Presbyterian Hospital. I cover the ambulatory surgery and the outpatient clinics for the Weill Cornell campus, which includes our other ambulatory center, David H. Koch Center. You know, every PX lead has their Q review areas at our different locations. But I kind of came in, and being the only outpatient person and us not having a data specialist at the time and all of that, I sort of became the Q review point person for the institution, you know, as I don't have inpatient units and I spend, you know, I spent more time in Q reviews for all of the campuses. So, you know, I've learned a lot of interesting things from it, and, you know, I'm excited to learn from all of you.
Great, thanks, Naomi. So I'm just going to go off of this proposed agenda, but again, I'd love to make this as interactive and really as a conversation, and try to emulate as if we were literally around a round table in person. So feel free to